What if there was a tablet that reduced inflammation, improved cardiovascular outcomes, potentially reduce your risk of heart attack and stroke? If you'd like to find out more when we discuss this tablet, keep watching. So it's not really a great segue into it, but we were going to talk about if there was something like a medication or something like that, and pentoxifylline is something that Mike's taken for quite a few years. I mean, it seems to have quite a few. If, like as you mentioned, it's shown to have multiple mechanisms of action, and I'm going to let Mike talk about it a bit more. But that could be something, if it's not shown to, like you say, cause any harm, that it could be a contributing factor or a tool in the toolbox. Potentially, I suppose you talk about, is there familial, like my family, I've got cardiac disease in the family. So would I potentially try and nail all the things you just mentioned and then look for things to ice the cake? Maybe. Could pentoxifylline, which Trental, I think, is one of the brand names of it. But Mike, I'll let you run away with it because, it was relatively new to me until a few years ago.
I know a little bit about pentoxifylline. Oh, sorry, Mike.
Yeah. No. Sorry.
I introduced it, but I mean, if I wanted to talk to you about it because it kind of, I found, gets underrated. I know it was originally meant for intermittent claudication and reducing pain, but it can also help the blood flow more easily, reduce, in some ways, viscosity, and reduce TNF alpha, potentially TGF beta 1. And what else was the benefit? And it lowers HSCRP, which I thought was interesting. So I just thought you may have some comments or thoughts about it. I've used it. It's almost been my insurance policy because prematurely I was put on statins with a doctor in America. And he's like a friend of mine, and he meant well. And he thought, well, if you're going to be on testosterone, we just need to have a little bit of extra protection. And in the early noughties in America, everyone knows the cholesterol number at dinner parties, and doctors were very much being visited by drug reps to push the statins. And so therefore he said, I'm going to put you on a statin. So I didn't want to be on a statin because it contributed to further erectile dysfunction whilst I was on it. And so this was a good alternative, I thought, with one of the actually a sleep medicine doctor put me on it, and I've been a big fan of it. So I don't know what your thoughts are. And one more thing, it was in one of the British journals, an article, I think in the BMJ journal, about it's so underrated.
Yeah, you're right. I mean, it's a medication I know a little bit about. It's a methylxanthine derivative. It has been used for intermittent claudication, as you know. Intermittent claudication is this condition where you get narrowings in your blood vessels, and because the blood vessels are narrowed, when the muscles need more blood, the blood can't get through and the muscles ache. So typically leg muscles ache when you walk, you stop, the ache settles down. In some ways, heart disease is a little bit like intermittent claudication because it also involves narrowings of the blood vessels, so the process is much the same. Whenever you're dealing with any vascular problem, then any agent that opens up our blood vessels is a good thing. On top of that, another thing that we know is that when your blood vessels are narrowed, it tends to cause stagnation of blood. And because you get stagnation of blood, you can form clots suddenly, block off the vessel. Those are what happens with heart attacks, etc. So if you have an agent which opens up the blood vessels, but also reduces the clotability of blood or reduces the aggregation of the platelets and makes the blood in some way a little bit easier to flow through, that's a really good thing. Number three, we know inflammation is a big problem with any kind of vascular disease. It develops because of chronic inflammation. B, acute inflammation will make things significantly worse, cause catastrophic event. So if you have something which has been shown to have anti-inflammatory effects measured by what it does to things like interleukins, interleukin-1, interleukin-6, tumor necrosis factor alpha, anything that does is a good thing. Pentoxifylline has all these properties. And has been shown to improve symptoms in intermittent claudication. So it's certainly an agent worth looking at. It seems to be reasonably safe. And so there are some studies that have looked at it. Again, it is a medication that has lost its patent, so it's off patent, so no one is going to make money out of trying to work out whether it's helpful or not. But there have been studies. In terms of atherosclerosis, for example, there was a study in rabbits. Now, you can't necessarily extrapolate what's happening in rabbits to humans, but these rabbits were fed cholesterol-enriched foods, and they were then given oral pentoxifylline, and it was found that those rabbits had a 38% less area of plaque. So that's interesting. There was another study, again, I think it was in type 1 diabetic adolescents, and they wanted to measure their, it was only 6 months long, but they wanted to measure their carotid intima thickness as a measure of, how much atheroma you're developing, the thickness in the blood vessels. And they found that it reduced this measurement in type 1 diabetics, but those on placebo, it actually went up slightly. Again, interesting, certainly this should make us ask more questions. It doesn't mean, oh yes, go and get it, but it does mean, well, we shouldn't ignore this. Here's something that's potentially be beneficial. Let's look further. When you look at events, okay, so that's all very well. How does it translate into events? There was a 6-month study looking at and a randomized placebo-controlled trial looking at pentoxifylline versus placebo, and there was a 34% there was a 34% incidence of people requiring either dying after a cardiac event, or having an MI, or having a non-fatal heart attack, compared to 13% with pentoxifylline. So again, interesting. Small studies, what they should do is inform bigger studies. They don't necessarily mean we should jump and everyone take it, but what it certainly means is that we should give it some attention and look. Again, control of stable angina, people who took it seem to do better. Well, that would make sense, because angina is intermittent claudication of the heart, and therefore if it's worked for intermittent claudication of the legs, then it should work for the heart. It does. So people get less angina with it. There's been, what else was there? There was stroke, reduced patients who had a stroke had a better outcome if they had a bit of pentoxifylline, if they had some pentoxifylline on top of standard therapy. There were some small trials that suggested that maybe, it could reduce vascular dementia over a period of time.
That's right.
Even patients who'd had a bypass, when you have had a bypass, there's a lot of inflammation going on that results in prolonged hospital stays, more complications. And in patients who took pentoxifylline, there was reduced ITU stays, reduced post-operative ventilation, etc. So lots and lots of potential benefits shown in small studies. It is certainly worth studying in a bit more detail, to my mind. Firstly, again, to try and make sure, is it safe? And B, do those benefits that have been shown in these small studies translate into benefits seen in a bigger population?
So I suppose there is some safety, as they've been approved by different drug agencies over the years, at least for its indication for intermittent claudication. So that always gives me great hope, whenever they repurpose an old drug for other uses that are related. That happens with so many things. Essentially, what like Viagra, Cialis, and tadalafil, the PDE5 inhibitors, were repurposed from blood pressure medications for pulmonary hypertension. So
absolutely.
Anyway, we sometimes refer to it as the kind of the poor man's Viagra, the pentoxifylline, for some of its benefits. But anyway, that's just one that I remember when I was worked. Before speaking to other doctors in the past, I always mention that, and many people don't really know about it. So it's good that you're quite clued up on it. So thank you for commenting on it.
I suppose we have quite, if it's been around for a long time, it actually in treatment in patients, and that we've got that sort of, there's reassurance of there would have been, if there were drastically harmful effects of it, we probably would have had that feedback and it would have been avoided by now. There must be some sort of credence to that as well. Potentially.
Yeah, absolutely. I mean, if it's been around, it's been around for more than 3 decades now.
Yeah.
So that's reassuring. Of course, you want to use it in in different population groups to feel confident, But absolutely, I mean, I completely agree. What I've read, it looks very encouraging.
Brilliant. Okay, so thank you, Dr. Gupta, for joining us today. I hope the viewers, found that helpful. If you would like to listen to more information and get more information about this, please subscribe, ring the notification bell, because you'll get notified of more content like this. And thanks for joining us. So we'll see you next time.
Okay, see you next time. Thanks.